Now we are going to learn about cold test. So what's the cold test? We perform any cold material, instrument, eyes to the tooth surface, exposed tooth surface, and note the patient's reaction. That's how we perform the cold test. So, what material is used? The material is preferred is called endo ice, which is called as 1112 tetrafluoroethane. So it is also called 112 tetrafluoroethane. The most common way to perform this test is apply a cotton pellet saturated with endo ice to the tooth being tested. And endo ice you can see in this image. Carbon dioxide or dry ice. Carbon dioxide has also been used for the cold days because the temperature of dry ice is minus 78 degrees Celsius. One is able to penetrate full coverage restoration and elicit a reaction from the underlying tooth to the cold test. हम कोल्ड टेस्ट के लिए कार्बन डाइऑक्साइड भी यूज़ कर सकते हैं क्योंकि इसका टेम्परेचर -78 डिग्री सेल्सियस होता है जो कि फुल कवरेज क्राउन रेस्टोरेशन पर अप्लाई करने पर भी एक रिएक्शन दे सकता है। तो रेस्टोरेटिव टूथ वाले पेशेंट में भी ये कोल्ड टेस्ट बिकॉज ऑफ ड्राई आइज परफॉर्म किया जा सकता है। The test should be done on a controlled tooth before being done on the tooth of interest. पहले हम एक नॉर्मल टूथ पर ये टेस्ट करेंगे, उसके बाद पेशेंट की कंप्लेन है जिस टूथ में पेन हो रहा है ठंडी की वजह से, तो फिर हम उसमें करेंगे। When we see the response on the tooth of interest is similar to that of the controlled tooth, it indicates a healthy pulp. जब हम टूथ ऑफ इंटरेस्ट जो हमारा टूथ है जिसमें पेन हो रहा है पेशेंट के टूथ में, उसका रिस्पॉन्स कंट्रोल टूथ के रिस्पॉन्स के जैसा ही होता है, तो ये इंडिकेट करता है कि हमारा पल्प हेल्दी है। If the response is short, sharp pain that disappears rapidly once the stimulus is removed, it suggested reversible pulpitis. जब कोई शार्प शूटिंग पेन होता है जो कोई भी कोल्ड स्टिमुलस को देने से पेन होता है और जैसे ही हम कोल्ड स्टिमुलस रिमूव करते हैं तो पेन भी चले जाता है, तो इसे बोलते हैं हम रिवर्सिबल पल्पाइटिस। इफ द रिस्पॉन्स इज excruciating pain that lingers on even after the stimulus is removed, it's called irreversible pulpitis. जब एक अनबियरेबल पेन होता है और ये लॉन्ग टर्म के लिए होता है, जब हम स्टिमुलस देते हैं या स्टिमुलस कोल्ड स्टिमुलस को रिमूव भी कर लेते हैं उसके बाद भी लंबे समय तक ये पेन रहता है, तो यह इरिवर्सिबल पल्पाइटिस होगा। If there is no response, it indicates the pulp may be non-vital or pulp is dead. The diagnostic accuracy of the cold test is 86% and the accuracy of the EPT or electric pulp test, it is a machine which measures the reaction. Electric pulp test accuracy is 81% and the heat test accuracy is 71%. Hence, clinically a combination of cold test and the EPT is recommended. Cold test can be used to differentiate between reversible pulpitis and irreversible pulpitis. Now we are going to see the electric pulp test. So, what is the electric pulp test? The objective is stimulated a pulpal response by subjecting the tooth to an increased degree of electric current. By the electric current, the tooth is tested and the response is noted on the screen, and that's how we test the pulp response by electric pulp tester. So now we can see the responses of the electric pulp test. If a positive response is an indication of vitality and helps in determining the normality or abnormality of that pulp. If no response given by electric pulp test to the electric stimulus, it can be an indication of pulp necrosis. अगर इलेक्ट्रिक पल्प टेस्ट मशीन में एक पॉजिटिव रिस्पांस आता है तो ये हमें हेल्प करता है ये जानने में कि पल्प वाइटल है या उसमें में भी कोई एबनॉर्मलिटी हो सकती है। लेकिन अगर कोई रिस्पांस नहीं आता है इलेक्ट्रिक पल्प टेस्ट में इलेक्ट्रिक स्टिमुलस देने के बाद भी, तो ये इंडिकेट करता है कि पल्प नेक्रोसिस हो सकता है। So now we are seeing the procedure of electric pulse test. Firstly, explain the test and reduce the anxiety of the patient. And the second is then the teeth to be tested is air dried and isolated. Normally with cotton walls, the test is always done on a controlled tooth first. Test is done on controlled tooth first. Remember it. Apply an electrolyte or professor paste or toothpaste on the electrode and place it against the dried enamel, the crowns of mesobuccal or incisobuccal surface. It is important to avoid contacting any restoration in the tooth or the adjacent gingival tissue with the electrolyte or the electrode. This would cause a false or misleading response. When we apply the electrolyte profile paste or placing the electrode, we must avoid the contacting any restoration in the tooth or other tooth present or any adjacent gingival tissue because it would cause a false or misleading response. The placement of the pulp tester tip should be on the incisal third of the anterior crown and middle third of the mesiobuccal cusp for molars and buccal cusp for the premolars. As we can see in the diagram, the incisal third of the anterior crown and the mid third of the mesiobuccal cusp for the molars and the buccal cusp for the premolars. And the circuit of the pulp tester tip should be on the incisal third of the anterior teeth and mid third of the mesiobuccal cusp for the molars and the buccal cusp for the premolars. The circuit system should be completed by placing a ground wire clip in contact with the oral mucosa over the patient's lip or by asking the patient to place a finger on the metal sheet of the pulp tester. Here we can imagine the tooth EPT is placed on the tooth in the ground wire. This is a ground wire placed on the oral mucosa of the patient, or we can see in this image. Then the patient adjusts the rheostat on the tester until a response is elicited. The clinical interpretations of the response to the electric pulse tester are as follows. response or a positive response is one that occurs at the same electrical threshold as the controlled tooth. When a negative response or no response is when the tooth does not react even at the highest setting of the electric pulse tester. This indicates as necrotic pulp. If we get early response, it denotes a diseased state of the pulp as the tooth responds to the threshold that is less than that of the control. In delayed response denotes a diseased state of the pulp wherein the tooth responded high at a significantly higher excitation level compared to the control. The early response comes when the lower threshold given on the control tooth and in less threshold the tooth of interest is responding, but the delayed response denotes the type of disease state of the pulp where the higher threshold excitation given to the tooth of interest as compared to the tooth of the control tooth. So the pulp test can also give both false positive reading or the false negative reading. So now we are looking the false positive readings and what is the false negative readings. So what is the false positive response in Hindustan? In multi-rooted teeth in which the pulp is partially necrotic with some nerve fibers still vital in one or more of the root canal. The electric pulp test gives a false positive response. जब किसी मल्टी रूटेड टीथ में पल्प पार्शियली नेक्रोटिक है या किसी कैनाल के नर्व फाइबर्स अभी भी वाइटल है तो फॉल्स पॉजिटिव रिस्पॉन्स आता है. False negative response. When there is a extensive calcification in the pulp tissues or dentin. जब pulp tissues और dentin में extensive calcification होगा तो false negative test आएगा. Now we can see the false negative test. In a tooth with increased reparative dentin and diminishing pulp cavity, the false negative test can be given by the electric pulp test. In a tooth with the fibrotic pulp and in a teeth with extensive restoration and a pulp protecting base and in recently traumatized and in recently erupted teeth with incomplete root formation, pulp test will be negative. So here we can end our lecture pulp test or pulp sensibility.